Namaste. A very good morning to all of you because today is a very important topic that we are going to speak about. Ayurveda, a strong key to lower sepsis and antimicrobial resistance. Ayurveda from the Vedic times have been speaking about Sarve Santu Niramayaha, whether it is flora, fauna, human beings, everybody. Uh, Sarve is all. Santu to be Niramayaha, to be free of all disease. So it's a very high ideal that our acharyas had. So let us dwell into how. WHO declares antimicrobial resistance as a global threat. So antimicrobial resistance over time no longer respond to medicines. Infections harder to treat, increases risk of disease spread, severe illness and death. So misuse, wrong use or overuse, wrongly used leads to drug-resistant pathogens. So adding to that, no clear water, sanitation, inadequate infection prevention control spreads antimicrobial resistance. It also has an impact on economy, death, disability, hospital stay, expensive medicines, and these are all the challenges that we are facing today. So, lacking effective antimicrobials enhances risk during surgery, chemotherapy, transplant, treating infections. So, multi and pan drug resistant pathogens, superbugs, rapid global spread, a major concern. Antimicrobials fail even in simple ailments. So we have GLASS, Global Antimicrobial Resistant and Use Surveillance System. New and antimicrobials are urgently needed is the big claim that everybody is making. So can we say no to antimicrobials? Antimicrobial resistance, um, overuse of prescription of antibiotics when it is not necessary, um, prescribing in viral conditions, antivirals, antifungals, antiparasites. So Ayurveda speaks about enhanced tissue immunity. So we can take a look at what are the Ayurveda solutions. So it needs to be handled with care, antimicrobials to be handled with care. So you need to select the right drug, right dose, duration, community, hospital, nation, individual. So we need to look at what can be done. Um, Before that, we'll take a look at the history. Alexander Fleming, as you all know, who had a Nobel Prize for his penicillin, and during that speech, he also said that we need to be cautious because we can develop resistance towards that. So these were the people who contributed and were honored. So, just a small look at what is microbiology. Was microbiology uh, uh, known in Vedic times? So, Gnanachakshu, Tapaschakshu are the words that are given to see the Ati Sukshma uh, um, creatures alive we see. Bacteria, fungi, protozoa, algae, viruses. So, what is the golden age of microbiology? Pasteurization, fermentation, Joseph Lister. You have so many, Robert Koch, um, uh, his pustules, Edward Jenner. We have so many of them, and we look at that it is all uh, once it reigned supreme the antibiotics, but today it is all like we have trumbled it off. Antimicrobial resistance, so we need to improve awareness. What is antimicrobial resistance? To strengthen knowledge through surveillance and research, to reduce the incidence of infection, uh, and develop economic ease. We have so many things to be thinking about. So, what are antibiotics? L- But in Ayurveda, we say let's not be against life. So, what can be done? Here are a list of antibiotics when they were approved by the FDA and when they developed resistance. So you can take a look at it when you are free. Each one has been approved and then it developed resistance. So we have nearly 100 antibiotics today and most of them are resistant. So bugs are coming up. So once we had a lot of antibiotics, and we thought that was the best thing that could happen to human beings. But today we are powerless. We have to see that antibiotics have developed resistance, and we need to see what can be done. And antivirals are again a much bigger concern. Factors contributing to antibiotic resistance, environmental factors, huge populations and overcrowding, rapid spread, poor sanitation, increases community acquired resistance, ineffective infection, drug related factors would be fake drugs, quality of the drug, soaring use of antibiotics, over the counter antimicrobials. We have to also see what are the other ways that antimicrobial resistance is happening. It is because we are using in farm animals and in agriculture, which is definitely not necessary most of the time, and it adds to the resistance to a very great extent. We need to understand how and why it needs to be controlled. But before that, we can see uh, why Ayurveda thinks about health for all. Did Ayurveda know microbes, infections, spread of infection? Did they know about antibiotics, antimicrobials? We have to think of so many things. Global challenges. It's Ayurveda is Indian traditional medicine. It has been from the Vedic period to present day. So it is personalized medicine, genetic individuality, and more. Uh, in India, we have genetic prevalence, genetic predisposition to say no to antibiotics. Prevention, preservation, and promotion is what is Ayurveda all about. Evidence based in centuries. So we need to understand what we can do with Ayurveda and yoga. Ayurveda in ancient India from the second millennium BC, Vedic period, Rigvedic period, so on. So we need to think about time to mainstream Ayush. These people had contributed and they are forgotten. Um, in the Vedic period, we had Vedic literature. We see that there were people who contributed to understand microbiology. We have a list of people in the Vedic culture who contributed immensely to understanding microbes. So, in the battlefield, uh, Ayurveda flourished. Ayurveda came up to mean much more because it is extensively used in battlefield casualties, emergencies, and we had a lot of surgeries being done. We had theranostics, diagnosis and therapeutics. We had a very fast way of diagnosing in the Purva Rupa, that is prodromal condition itself. So we could say no to antibiotics. So Krimi was the pathogenic, non-pathogenic and pathogenic. So Sunama and Durnama. We have Atrideva, Kanva, Jamadagni, Agastya. The names of the Vedic microbiologist. You can find where and how you could read about it. Sushruta speaks a lot about Krami, Sankramika Roga, how infection spreads. Everything was known. And Krimigna Dravyas, Tulsi, Neem, Vidanga, Haridra. You have a huge list of medications which act against microbes. Then Krimigna Dupa. It was not only herbs, it was Homa, Rakshogna Mantra. Um, Say no to excessive hospitals and hospital stay. We had Krimi is that which attacks and goes deeper into tissues and can destroy. So they had a very clear picture about what microbes can do and how it needs to be controlled. So these were the beautiful description of Krami that we have in Ayurveda. How were they? They were microscopic structures, and what was the description? What was the color? What was the way of its movement? Everything is available in Ayurveda. We have Ayurveda classification, prasangat, gatra samsparshat, nish. So how it spreads. They knew how it would spread and what should be done to control that. Every little microbe was understood. Viruses were also understood. So Krimi is, as I have been telling you, it attacks, it eats up, invades, infects, and destroys. And it is Anu, Sukshmanu, Ati Sukshmanu. We have Raktaja Krimi, which is found in the capillaries, blood vessels in every way. So it is not that blindly it was told. Microbiology was very well known in Ayurveda. So we have few cases which have been treated by only Ayurveda, no antibiotics. Dacryocystitis, wherein pus is present in the dacrobes. So we had to use leeches, and it was we found that it never came back. So no recurrence, and it was cost effective, safe, and fast. Chances of infection is strength of microorganisms, number, resistance to antibiotics. So we have a lot of things to say about how antimicrobial resistance could be managed. Idiopathic orbital inflammation. We have cases like this, antifungal, so you can treat these type of conditions. And here we have super specialization, which speaks about Vranakovida, Vranagandagna, Vranachintaka. So people, the pathology was very well understood about microbes, and what type of infection that happens. Dushta Pratishaya, the common respiratory conditions, measles, diphtheria, COVID, everything was there. Then tuberculosis. So we had honey, which is today claimed as to be one of the super medication for superbugs, but just not honey. It cannot be, it is part of the treatment. So we have cost effective and time tested a big list of medications, not just medications, we have ways of treating antimicrobial resistance. This is antiviral, and how we have been treating antiviral conditions, hepatitis B, herpes zoster, herpes simplex. We have bacterial conjunctivitis, nodular episcleritis, we have fungal infection. So earlier the infection is started being treated is very fine. Dinacharya, so Dinacharya, Rutucharya, Sadvrutta, Rasayana, Rasaushada, we have a huge list of um, solutions that can help in antimicrobial resistance. We need to give it a good look at it. Effects of Rasayana, to say no to AMR, we need to have the Rasayana. Rasayana is like every day, what you take every day, what you eat, what you think, how you behave, so many things. So new natural drugs a solution is what people have been speaking about. Globalization demands standardization. So we want to globalize Ayurveda, then we need to think of very seriously about how Ayurveda and yoga can become the globalized solutions to say no to AMR. COVID, SARS mutation, these are the conditions that we have been treating and published reports. You could see that. Then Visarpa is herpes. Herpes was very well known in Ayurveda and how it could be treated and what could be done. Pranagandagna, as I have been telling you, is just by the smell of the wound or the infection, people could understand what could be done, what has to be done. So, pathology in Ayurveda is something which we really need to look at. And apart from herbs, we had Homa, Havana. These are different types of Homa which could be done to take care of fungal infections, bacterial infection, viral infections. So we have Atisukshma, Adrushya, which includes everything. Ayurveda management in neonates, you can say no to antibiotics. Ayurvedic management of COVID conjunctivitis, you can say no to, and then if you say yes to Yamaniyama asana, being healthy is the best solution to say no to antimicrobial resistance. So we had filariasis being managed. We had a lot of herbs known and some unknown. So natural products, we have antibiotic discovery, some known, some unknown. So if you want to say no to antimicrobial resistance, we need to stop using antibiotics. So neem, which is in every village, is antibacterial, antifungal, antiviral, antimalarial, bacteriostatic. We have, when student used to ask me whether we had antibiotics, antivirals, steroids, so the thing is answer is no, we had nothing against life. We had rasayana to go along with all these medications, so it added to the condition. So drug resistant infections is a huge problem. So in the intensive care units, oncology units, dialysis units, rehab, transplant units, burn units, we have a very scary proposition that in 2050, the mortality by drug resistant infection could be huge. And we really need to take a look at what Ayurveda and yoga can um, give. If we want to say goodbye to antimicrobial resistance, how and when, health with no medicine is the way to go. We have to say no to antibiotics. We have to say yes to dinacharya, rutucharya, yama niyama asana, live without antibiotics, adopt yoga and Ayurveda, and that will be, we go a long way to say no to all this. Thank you very much for giving me such a patient listening. We are ending the uh, discussion with Ayurveda, which was innovative. It is yoga and Ayurveda is innovative and with excellence. So, thank you for giving me this uh, patient listening.